COVID, obviously, as you've pointed out, it's sort of, again, exposing these inherent issues. Is there any reason to think it could potentially, because of the damage it's done and this new valuation, hopefully the public has on the infectious disease specialty, could it help incentivize additional change beyond that?
No, I don't. So this I keep hearing, oh, COVID's going to lure people into no, I don't think that's true, right? Medical student debt is what it is. ID physician salaries are what they are. We will continue not to fill. We will continue to have people choose to go into cardiology or GI or become surgeons or anesthesiologists or dermatologists. But there is one way in which I think COVID can clear a path to the future if ID docs are brave enough to seize it. We are now approaching $27 trillion of federal debt. We're running $3 trillion deficits. We are becoming a debtor nation, and it is going to drag down our economy. It is also going to crowd out in the federal budget the ability to do things that are important, like homeland security and transportation and education. So we're no longer going to have the luxury in a few years to be able to continue spending $3.65 trillion per year on healthcare. The only way that gets fixed is by healthcare reform. In the United States, we spend two to 2.5 times more per capita and per GDP than our peer nations. And for that massive excess cost, we live shorter lives and have higher mortality rates. We are being ripped off. Americans are getting ripped off by our healthcare system. We are not going to really have a choice at some point. The only way you're going to free up $500 billion a year or even $1 trillion a year to help pay down debt and pay for these other critical things that are needed, like global pandemic response, is to fundamentally reform healthcare. The ACP has recognized this. They have shown leadership. Where is our leadership? Where are our groups of people standing up and demanding from the federal government that we stop incrementally tweaking a broken healthcare system and actually rationally design a meaningful one?
And where exactly would you want to see that reform, I guess, make more immediate changes? How would you want that to look?
We need a universal healthcare system, right? Now, we can debate whether it should be single payer, whether it should be private multi-payer. In point of fact, again, as covered extensively in the book, there are international models of both. It's not true that you need single payer to achieve universal healthcare. You know, Switzerland, the Netherlands, Germany, France, examples of countries that have multi-payer healthcare systems. But I will point out, single payer systems are almost uniformly less expensive and more efficient, and generally, with a couple exceptions, deliver better outcomes. The problem with single payer in the United States is politics and culture. Americans tend to be less trusting of government than people in many Western European nations. And so what the book essentially argues is, if one side says it has to be single payer and the other side says it has to be multi-payer, we better find a way to bridge the divide or nothing will get done. And there are 2 countries in the world that have bridged that divide. And they've essentially said, you know what, we're going to do both. We're going to have a single payer that covers everybody, but for people who want to spend a little bit more, they can purchase their own private plan that will sit on top of the single payer plan. It's sort of like, the analogy in the book is, you're driving on a public freeway, it's crowded, there's a toll lane or a fast track lane next to you. You choose to go into that lane, pay extra, and get that service. Works just like that. And those 2 countries, Australia and New Zealand, have amongst the most cost-effective, highest performing healthcare systems in the world. What could be more American than saying, oh, you think you're right and you think you're right, let's do both and let them compete head to head and see which one wins.
How long have they had those models in place? Exactly, I guess, is that just historically part of their?
No, actually, several decades.
Okay.
You know, so most countries in the world at some point in the last 50 years did undergo a rational planning process for their healthcare systems. The Australian system is very instructive in many ways. It is one of the most cost-effective, highest performing systems in the world. Their single-payer system is called Medicare. I mean, it really, you could learn so much from them. There has been a tension in Australia, swinging back and forth over the last 20, 25 years about whether the government should emphasize the single-payer aspect or the private multi-payer aspect. And so politics swing back and forth, and people say, well, that shows no side is perfect. And that's the point, right? We don't have to choose perfection. We don't have to be afraid to cross the divide and give both parties something they want. We can achieve a compromise, and we'll learn as we go. As we do it, we will be spending much less money on healthcare than we spend now, and we will achieve better results.